Today I'm going live with Colief Baby Clinic to be able to talk all about colic. Colic is incredibly hard to be able to manage, and I speak as a mum whose eldest daughter had colic, and trying to find what the reason behind her colic was incredibly challenging. It was one of the hardest things to be able to actually manage and tackle and pinpoint. And colic is a condition where the baby has lots of inconsolable crying. It's defined as 3-3-3, so 3 hours a day or more, for 3 days a week or more, for 3 weeks or more. And that's incredibly hard on a parent's mental well-being in that postnatal period, because to have a baby crying at you is just so challenging, and it affects about 1 in 5 babies. There can be lots of different reasons for colic and lots of different theories. For the majority of babies, it will peak around about around about 8 weeks-ish, give or take. And for a lot of babies, it will decrease around about 4 to 5 months postnatal for those who are experiencing that colic. So it's something that as that baby gets older, it tends to get easier, it tends to get better for the majority of babies. So how do we manage sort of the symptoms of colic? What does a colicky baby actually look like? So more often than not, it's not just the crying, but there'll be other symptoms. There'll be things like the knees into their chest. So they'll be bringing their knees into their chest and sort of clenching almost. They'll be really inconsolable. Anything that you try, you're doing your best. And I want to make it clear, like if you've got a baby with colic, you are an amazing parent. It is nothing that you have ever done wrong. It's just incredibly hard. Sometimes they can arch their back, and so they look really uncomfortable because they're arching their back, they're clenching their fists in a lot of cases. They've got trapped wind, and sometimes as you're doing that sort of that knee to chest movement, that wind in itself is being released. So you might hear them fart, you might hear them burp, for example. All of these things can potentially be a sign of colic. And they can sometimes get really, really red-faced with their crying as well. So they become so inconsolable that they become really bright red in the face, and they're just screaming a lot of the time. And as a parent, there tends to be that little bit of a gut instinct to say, I feel like there's something more than just baby crying here. I feel like this is something like colic, for example. It feels more than just normal newborn crying. And that's often where parents are really correct. And I would always recommend that you have a conversation with your health visitor, with your midwife or your GP if you do feel like your baby has got colic. Now, throughout the last 24 hours, you've been submitting your questions. So I've got a few here to be able to answer. And as I've said, if you can, pop your questions in the chat. So one of the questions was, can you prevent colic? And in short, not massively. It depends on the reason for colic. So there are lots of different reasons for colic. One can be trapped air and trapped wind. So that's why we now recommend things like paced feeding if you are bottle feeding, for example. So if you're breastfeeding, making sure that the latch and the attachment is correct, that will reduce the amount of air that the baby is taking in when they are breastfeeding. Things like tongue tie can also increase the chance of excessive air intake. And that's because if that baby is not adequately latched at the breast, what can happen is that air intake can increase. With bottle feeding, paced bottle feeding is what we recommend. So that's where you actually now keep your baby upright and you do a small amount of a feed using an anti-colic bottle, take it out, wind them, try and get any trapped air up, and then that will help lower the amount of air that's going into that digestive system. And that in turn can lower the impact of colic and lower how colicky a baby is as well. So paced bottle feeding, small amounts, wind frequently in between if you are bottle feeding. Another reason for it can sometimes be that there is sort of a lactose intolerance. This is usually transient, so temporary in that case. And there have been studies that have found that lactase enzymes, so I'm doing this with Colief because they have their own product, Colief Baby Drops, and that contains an active ingredient that helps to break down lactose, which is a natural sugar in both breast milk and formula milk. And what that can do in itself is actually break down that lactose, break it down much more easily. Therefore, the baby's digestive system is more in equilibrium. So actually it works a little bit better. And the baby then has less colicky symptoms, less digestive discomfort, less wind as a result. Another reason can be things like allergies. So allergies can sometimes cause colic. This was the reason behind my own daughter's allergies. And I only discovered it when I went for an afternoon tea and had lots of dairy. And then suddenly the colic had got worse with other symptoms as well that she'd been having. And it just suddenly clicked in my head that it was dairy related, and cutting that out was the thing that worked for us. So when we think about preventing colic, it's actually quite challenging. The things to prevent it include during pregnancy itself. So during pregnancy, thinking about things like probiotics for yourself. There has been links with probiotics in pregnancy and for the first 4 months of taking it yourself in reducing allergies. And if you reduce the chance of allergies, your baby doesn't have allergies, and that lowers the chance of colic. Using anti-colic bottles as well, if you are bottle feeding, that will also reduce the chance of colic. So that's another way to kind of prevent it. And other than that, there's not a huge amount that parents can do. It's also being aware that if your baby's had any antibiotics in the postnatal period, that can increase the chance of temporary lactose intolerance. And so that in itself can cause that transient lactose intolerance for babies, which can increase the chance of colic.